What your doctor is really thinking? What they wish you knew before you even walked into the exam room? Well, today we're pulling back that curtain. We're getting into the essential health insights that medical pros want every single patient to understand. So think of this as your personal playbook for becoming a more empowered, more proactive patient.
Okay, so here's our game plan. We've broken this down into 5 parts. First, we're going to learn how to decode your body's signals. Then, we'll get into the stuff your doctor absolutely needs to know from you. After that, we'll have some fun busting common health myths, learn a few simple but crucial life-saving skills, and wrap it all up with the daily habits of a truly proactive patient. All right, let's jump right into Chapter 1, Decoding Your Body's Signals. This is all about learning to listen to the messages your body is sending you every single day. And we're going to start with one of the most common and maybe one of the most misunderstood signals of all, the fever. You know, we're so often taught to see a fever as the enemy, right? Something you have to crush immediately with medicine. But what if I told you a fever is actually a defense mechanism? By raising your body's temperature, you're actually making your immune system work better and faster, while also slowing down how quickly viruses can multiply. So in a lot of cases, a mild fever is really just your body fighting the good fight for you. Next up, let's talk about a signal that's, well, defined by its silence. High blood pressure has a nickname, the silent killer. And it's for a really simple, kind of chilling reason. Most people have absolutely no idea they have it. There are usually no symptoms, which is why it's so often discovered completely by chance during a routine checkup. And this is exactly why context is everything. Look, a single high reading, especially when you've just rushed to your appointment and you're a little stressed, that doesn't automatically mean you have hypertension. For a real diagnosis, your blood pressure has to be measured when you are completely at rest. Usually they'll check it on at least 2 different days to get a true picture of what your baseline really is. Okay, now for a topic people can be a little shy about, but it is so important. When we talk about bowel movements, the range of what's considered normal is surprisingly huge. It can be anything from 3 times a day to once every 3 days. The most important thing isn't how often you go, it's consistency. The real signal, the thing to watch out for, is any sudden, unexplained change in your personal normal. So this leads us perfectly into Chapter 2, your doctor's need to knows. We've talked about listening to your body, now let's talk about communicating that information. This is all about what you absolutely need to share with your doctor. We're talking about information that could genuinely save your life.
I bet you'd be surprised how often doctors hear something like this. Oh yeah, I take 2 of the little blue ones and 1 of the pink ones. And while it might seem like you're helping, not knowing the actual names and dosages of your medications can be a huge problem, especially in an emergency. A super simple habit is to just keep a current list in your wallet or on your phone. It can make a world of difference.
Listen, this next point is not about judgment. It is 100% about your safety. You have to be honest with your doctor about your use of alcohol, nicotine, and any recreational drugs. Why? Because these things can have life-threatening interactions with medications, especially anesthesia. It also helps the medical staff manage any withdrawal symptoms if you have to be hospitalized. The same goes for things like sexual enhancement pills, which can be really dangerous with certain heart medications. Okay, this next one is a big flashing red light. It's a non-negotiable. For both men and women, if you see blood in your urine, that is a serious medical emergency. It is a major warning sign that something is very wrong. Don't wait, don't try to book an appointment for next week, go to the emergency room right away.
All right, it's time for Chapter 3, where we get to separate fact from fiction. Let's bust some of the most common and sometimes pretty harmful health myths that are floating around out there.
First one up, the whole myth of detoxes and cleanses. You've seen them, right? There's a great saying for these kinds of products. They promise to slim your waist, but they only slim your wallet. The truth is, you already have the most powerful detoxification system in the world built right in, your kidneys and your liver. They work 24/7 to clear out toxins, and guess what? They do it for free.
Here's another one, this time about supplements. We tend to think more is better, right? But your body isn't a gas tank. If you keep pumping gas after the tank is full, it just spills out and it's a total waste. It's the same with a lot of vitamins. Taking more than your body can use doesn't make you healthier. It just makes for really expensive pee. Getting the right amount is what actually matters.
Now for a really crucial piece of advice for women's health, and it's super direct. Do not use soap or any of those cleansing products inside your vagina. The outside area, the vulva, can be gently cleaned, sure, but the internal canal needs to be left alone.
And if you want the perfect analogy to remember why, here it is. The vagina is like a self-cleaning oven. It has this perfectly tuned acidic pH balance that's designed to keep itself healthy. When you introduce soaps and other things in there, you mess up that delicate balance, which can actually cause irritation and infections.
Okay, let's get into Chapter 4, Life-Saving Skills. These are simple things that literally anyone can learn that can have a massive impact in a critical situation. Let's start with CPR. If you're ever in a situation where you need to do it, there is one number that is more important than anything else: 100. For CPR to actually work, you need to be doing about 100 to 120 chest compressions every minute. But how in the world are you supposed to keep that rhythm going in a super high-stress moment? Well, there's a simple and surprisingly effective trick. Think of the beat to the song Staying Alive by the Bee Gees. Yep, if you time your compressions to that disco beat, you'll be right in that perfect 100 to 120 per minute range.
But the rhythm is only half of it. Your technique is absolutely crucial. You need to get right over the patient, lock your elbows straight, and then use your entire body weight, not just your arms, to push down hard and fast. You're aiming for a depth of about 2 inches. Trust me, it's exhausting, but you have to keep going until professional help gets there.
It's kind of incredible to think about, but sometimes the most powerful medical tools are the simplest ones. Proper hand washing is, without a doubt, one of the most important public health advances in history. Even now, in an age of antibiotic-resistant superbugs, good old-fashioned soap and water is still one of our best weapons against spreading infection. And that brings us to our final chapter, the habits of a proactive patient. These are the simple, everyday things you can do to go from being just a passenger to being the driver of your own health journey. So let's run through a few key habits. First, please resist the urge to perform DIY surgery on yourself. Leave stuff like ingrown toenails to the professionals to avoid a nasty infection. Second, never, ever flush old medications down the toilet. Take them back to a pharmacy so they can be disposed of safely. Third, if you have young athletes in the family, encourage them to play a bunch of different sports. Specializing too early leads to so many chronic overuse injuries. And finally, a really important tip for anyone with a baby. If an infant is crying and you can't figure out why, always check their fingers, toes, and genitals for something called a hair tourniquet. It's where a single strand of hair can wrap so tightly that it cuts off circulation. So we've gone through the whole playbook, from decoding your body's signals to adopting proactive habits. This knowledge, it's a bridge between you and your doctor. You've now heard what they wish every patient already knew. So the only real question left is, what are you going to do differently now?